kindly on the chat, tell us where you, who you are and where you're tuning from. Right there on the chat, and I'll be reading your shout outs in a short while. Let me know where you're logging in from and who you are, and I'll be sending out your shout outs to all of us. And so, ladies and gentlemen, also, it has been an awesome week. The president spoke on COVID-19, and you know, some of us thought, I've been thinking that COVID imeisha, we can remove all our masks and things like that. But let me know from the president's speech, what was exciting for you? What was exciting for you? Let me see that on the chat. So 3 things. Let me know who you are, where you're tuning in from, and what was most exciting for you on the president's speech. I'm waiting. Let me see the chat go wide, and I'm ready to read. I'm tuning in from Nakuru. It's been an awesome week, and I cannot miss any session of Candid Conversation. Tonight, it's gonna be explosive right here. We have with us Dr. Geofrey Mutuma from the Zambezi Hospital, and our topic tonight is amazing. We call it Prostrate Cancer Uncensored. Prostate Cancer Uncensored, because you know what? We will be talking about it, and in this Candid Conversation, we will be saying just as it is. Daktari is ready and waiting, and we will be bringing it live here virtually, and it's gonna be awesome. And we're saying that tonight, Prostate Cancer Uncensored is for all the ladies to know, and for all the men to be aware. And so, ladies and gentlemen, get ready.
Grandma, go and get my earphones. Go and get me my handbag.
I want to kindly, if you are already logged in, if you don't mind, mute. Let's all mute. If you don't mind, let's all mute, and let's enjoy the session. I want to send my shout outs. I was hoping and praying that many men join in tonight. And so I'll start with the men. Dr. Karibu Sana, Dr. Mutuma, I can see you. Let me see, I'm seeing Kasima. All right, Karibu Sana. I'm starting with the men tonight. I'm seeing Maina, you're logged in. Karibu Sana, Maina. Let me see, Samuel Mboro, Karibu Sana, you are a star. I'm seeing, let me see, I'm checking out men's names. Sam, Karibu Sana, it's gonna be great. Danny Gojiri, you're amazing. Wentland is right there. It's gonna be a good time. Toma, Karibu Sana. I'm sending shout outs to men because tonight it's gonna be a good night, especially for all the men are tuned in. Now, ladies and gentlemen, help me to remind your friend, your relative, your uncle, your dad, your husband, your brother to kindly tune in, okay? Because this is amazing tonight. It's gonna be good. So send a text to them right now and tell them to log in. I'm giving you a few to do that, and then before I invite my awesome doctor. I'm seeing a few. Faith Moreidi, thank you so much from Kisumu Pacho. Yeah, Faith, you're a star. Learning institutions to remain closed was the best caption for me from the president's speech. Safety of our children is paramount. Safety of our kids is paramount. Happy to be here tonight. Asante sana, Faith. I'm sure, Faith, you're having such a good time with the kids at home. So thank you for tuning in. Juliet from Nairobi. Juliet Modeu Wevau. Thank you for tuning in, Juliet. It's been a minute. My brother from another mother is saying his highlight is the president saying ati sasa uko na uhuru wa kukunywa pombe. He's tuning in from Moshi, all the way from Moshi. Asante sana. All right. So thank you so much. Guys. I'm waiting to get a few more from your side. I'm waiting to get to hear a little more of your highlights for tonight. What was your highlight from the president's speech, and where are you tuning in from? Lesit, I can see you. You are amazing. Thank you for tuning in. Thank you for tuning in, Edith. Thank you, Violet, Esther, Caroline, Irene. I'm Lucy Favor, always right there. I'm so grateful to see you and you tonight. It's gonna be a good night, and for sure, thank you for your support, guys. And it's gonna be better than last week tonight. It's gonna be better than last week. I want to remind you that here at Out Limited, we do several things that we do. One, we have our arm of training solutions where we do team building and corporate training for companies. We also have our events arm for our business called Outburst Events, and we keep it real. We sort you out from A to Z. And then we have our events holidays, which it's for you to help you sort out your holiday, your retreat. After hard work, you need to rest, and so we help you do that. But this BCC is courtesy what we call the Outburst Active. We started it as a fitness thing, and then we decided, why don't we do something to give back to our community, to our society? And we started something called the Boot Cancer Challenge. And here at the Boot Cancer Challenge, we share with you good news, and we keep hope alive, but we also shed the light, you know, and in terms of cancer, most people think that cancer is a death sentence, and we come in to just shed some light, keep the hope alive, and we encourage people to eat right, to exercise, to go for cancer screening, and to stay healthy, and to stay alive, and to keep hope alive. Here at Boot Cancer Challenge, the other thing we do is that we support the hospice in Kenya, and this year will be our 5th edition. Believe it or not, we've already done 4. The first one was at Central Park, the second one and the third, we held that at Arboretum. The 4th was in Kasarani, and the 5th, guys, will be right here virtually. And I can't wait, I can't wait. It's the first ever virtually, and it's gonna be great. So book a date with us on the 10th of October, which will be on a Saturday from 8 o'clock to 10:30 a.m. and we're gonna have a lot of good time. All right, my friend there is saying that my highlight is that I missed the president's speech, and someone lied that he said no mask. True or not? Where? Bado watu wanavaa masks, all right? Bado watu wanavaa masks. But here online, you can enjoy yourself. Violet is saying that my highlight from the president's speech was kids staying at home. But there is someone told me this week, actually it was on Sunday, that have you noticed how children have grown? All right, and they were saying, I think school is not good for kids, lakini nasema watoto watarudi shuleni, but let's keep them safe first. Let them enjoy our company at home, and in due course they will go back to school. It's never an emergency. It's not as important as their well-being. All right, Jay is saying my highlight, reduced pay as you earn, are still on till December. Hope it remains like that forever. Nimeshaona umeshabajetia your pay as you earn, endelea hivyo hivyo, na Mungu akubariki. All right, ladies and gentlemen, I want to take a short time and appreciate those people who over the years, year 1, 2, 3, 4, and hopefully even this year have been our partners and our sponsors. I want to thank you so very much. People have come, they have joined us time and again to make this Boot Cancer Challenge a reality, and we want to salute them. I want to salute my friends, A to Z Events, who have been giving us sound throughout the 4 years. I want to say asante to Unico, who have been providing us with the stage all the 4 years. I want to say thank you for House of Doti. They've been giving us the tents, the chairs for all the 4 years. We can never say enough thank you. I want to start with, want to pass our gratitude to the hospitals. The Zambezi Hospital, tonight presented by Dr. Geofrey Mutuma, who will be talking in a short while. Aga Khan, who have held our hands and worked with us. MP Shah have been there. You know, Medanta and other hospitals want to say asante sana. All the companies that have come on board for the past few years, the 4 years. I remember Safaricom have been with us. Shell, Vivo, they have been with us. Companies like China Africa as Friendship Association, they have supported us, and we want to say asante sana. And I will be mentioning more as we continue, but I want to say a big thank you to you, our viewers tonight, our attendees tonight, because without you there would not be Candid Conversation. And Candid Conversation is what we used to call the build-up activities towards the Boot Cancer Challenge. And so we just turned them around. We made it a Candid Conversation where all of us can be enlightened, inspired, encouraged, educated, and most importantly, that our lives would be enriched. And so thank you so much tonight. We are ready for prostate cancer uncensored. If you are ready, kindly type uncensored. Type the word uncensored right there. If you're ready, type the word uncensored. Then I know that you're ready. Bishop Abraham Jonathan Sana, I can see you. Karibu Sana, Bishop. Thank you so much for tuning in. All right, I'm waiting to see if all of you are ready for prostate cancer uncensored. Okay. I'm waiting. I also want to say a big thank you to our technical team, my team at Outburst. You guys are amazing. You're doing a good job. And thank you for your support. Without you, this would not be a reality. And so I want to say asante sana. Okay. I'm also typing uncensored. Let me see. Let's see. Thanks for the warm invite. I was afraid I'd miss out, so I was rushing home like the curfew ends at 6:30. Let's see, the curfew has been extended to 11, but thank you for rushing home. I believe you will enjoy this Candid Conversation tonight. I am seeing my wall is going crazy here. Edith, you're saying uncensored. Juliet, uncensored. Violet, uncensored. I can see that you guys are ready. And so without any further ado, I want to invite Dr. Geofrey Mutuma from the Zambezi Hospital to bring to us prostate cancer uncensored. But before we do that, kindly Daktari, unmute. I want to have a conversation with you before we go too far. Daktari, unmute. Daktari, I can see you, unmute. All right. Okay.
Unmute. Yes, I'm okay now.
Good evening, Daktari. You're
good. Good evening, how are you?
Good.
I'm doing well.
Very well, Daktari. Now, ladies and gentlemen, I want to introduce to you Dr. Geofrey Mutuma. It's not his first time, but he's here with us tonight. Daktari, you are making me feel not very well dressed. Thank you for representing us well dressed there with a suit. Today I'm a t-shirt so that I can show people how we will be dressed, on Saturday the 10th, from 8 a.m. to 10:30 at the Boot Cancer Challenge. But Daktari, let me ask you, Daktari is a COVID, I don't know if we are calling them COVID survivors, those people who have walked the tightrope and survived, and they're here with us. Doctor, people are thinking that COVID is a scam, that it is not real. Story yako, Daktari.
My story is quite long, and I'll make it short. COVID is real, and myself, I had COVID, and I was tested actually twice, and I was positive twice. And I spent 33 days in the hospital, 33 days in the hospital. And for the first thing that I was very
more
sick.
than a month.
Yes, more than a month. I was very sick, and actually, sometimes I lost my consciousness completely. I didn't know where I was. So basically, what it started with me, I started having chills and fever and fatigue and lack of appetite. Unfortunately, me, I did not have any cough at all. I was having fever, and of course, at the doctor, when I had fever, the only thing I thought first that I thought I'm having malaria. So I took drugs for malaria. Just took the drugs from the hospital, and malaria is simple. Anybody can treat malaria. So I gave myself 3 days. By the end of 3 days, I was very sick. I was not improving the way I expected malaria to be improved. To improve after 2 or 3 days with tabs, you'll be okay. You'll be able to become okay. I was still having fever. I was still actually this time by 3rd day I was vomiting too much. The vomiting was too much and the lack of appetite. So I decided to walk to my hospital. So I admitted myself in the hospital. So once I was in the hospital, of course, I was very fatigued and I didn't have appetite. I didn't have any energy. So somebody, in fact, my wife told me that let us check the temperature. I was very sick. I was sleeping actually in the bed, in the hospital bed now in Zabez Hospital, and I checked the temperature. Actually what shocked me is that the temperature was 38.5. In fact, I had to sit down, pick the thermometer and check it myself because I can't believe a temperature of 38.5, that's very high. So after that, I thought maybe it's malaria which is not responding to the treatment. So I started myself on quinine, IV quinine. So 1 or 2 days, I felt that I was doing very, very badly. So what I did, I called another doctor now because I found that I'm very sick. I cannot take care of myself. So I came and said that you are a very sick, doctor, and we need to take care of you now. So from that, the doctors took over. And then the first test they did is COVID, because the first doctor told us that I'm having COVID, which I did not believe. So the test was done and it came positive. And that time I was very sick. The temperature was going until 38, 39, 39.5, 40. And that time actually I didn't know where I was and I lost consciousness several times. And once I knew that I was having COVID, I know things are not good. Lucky enough, me, I did not have any cough. I did not have any respiratory complications. So I stayed in the ward with treatment. And of course, now we stopped. We continue with the treatment of malaria. Of course, we stopped quinine. We went to another artesunate treatment for malaria for another 3 days. It was not improving at all. So I was given antibiotics, and I was given a very high dose of antibiotics. And then for almost 2 weeks, I was quite sick, very, 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 very sick. I had collapsed several times. I didn't know where I was, and it was really bad. And of course, for me as a doctor, I knew that things are not good. And in fact, I reached somewhere there where I knew that this time now, me, I'm going. Whoa. Because I didn't know where I was. I was collapsing in time. I was losing consciousness. I could not sleep, and there was no night and day for me. So after 14 days, sort of I started improving. Remember, I was not eating. I was just be given IV fluids only because I could not eat. Whenever I eat, I could vomit. So I was not eating, and the appetite was not there, and I had not tasted at all food. But I did not have any cough. The fever was very high. After 14 days, the fevers came down. In fact, that's the time I knew that at least this one is better for me. And then after 14 days, I was tested again for COVID. It was positive again. Remember, I was tested before. It was positive. Now I was tested again. It was positive. So I waited for another 10 days. That is almost 24 days now. I was tested and it was negative. And then I stayed for some few days in the hospital because, of course, I didn't want to move out of the hospital until I know I'm negative. Because, of course, as a doctor, once I move out of the hospital, of course, I'll be seeing patients, and of course, it's not right. It's not ethical. It's not actually ethical to see patients when you had COVID. I don't know that you're negative. So I was tested and I was negative. But the only thing which was very difficult, there were 3 issues which are difficult with COVID. That's mainly with me. First is the first time I've been very sick, and the sickness was very acute and very severe. So after I got cured and I became aware of myself, in fact, the first thing is that I went to the mirror and I looked at myself. I cannot believe it was me, because it was horrible. The picture, I had lost almost 10 kilograms, and that actually was a bit, and I could not, the first time I could not wake up and go to the toilet. I could not dress myself. Yeah. So the first time I could even button my shirt, I said, thanks God, because I could not dress myself. I could not button my shirt. I could not wear socks. I could not wear shoes. It was horrible. So COVID is there, and me, I had it. Lucky enough, I survived it. The worst thing of COVID, actually, it is the psychotic part of it, the psychic part of it, which I was affected. Remember, you are there alone, and nobody is supposed to visit you. Of course, somebody was supposed to give you food, only supposed to visit you. Of course, my wife is a nurse, so he was coming and taking care of me. And that's I think, the only thing where I survived. I think that is God's grace that I was in my hospital. So I could, of course, I could command some few things. And my wife is a nurse, so she managed to take care of me. I was just imagining the times I've collapsed. If I was in a hospital, apart from where I was, could be very bad, because I really lost consciousness several times. And the worst thing of COVID is actually the psychic part of it, which it hit me very hard. That's depression. It was real. And of course, as a doctor, I knew that I was depressed, and I knew there's nothing I can do about it. In fact, I had to see a psychiatrist after I left all that, and I was okay, and I was discharged. I went home. I had the very bad depression, very bad. In fact, I had to see a psychiatrist who actually counseled me. I had to see a counselor who counseled me so that I come back to normal. Lucky enough, I did not use drugs for a long time. I used drugs for 1 or 2 days, and then but for sure, by the time I'm leaving the ward, by the time the last 5 days, I had a very bad depression, and it was real. And that's why when we say that the COVID patients have got psychic problem, in fact, it was very bad for me, and it hit me very hard. I knew that I'm depressed, and I could not do anything. And that's why, of course, I had to seek assistance from the rest from the doctors, which actually the doctors assisted me so much. And sometimes, in fact, they could not get any vein for me, so I could call another doctor to be able to come and see me. And that was actually quite bad. And that's a disease which is quite real and is very bad. And of course, myself, the worst thing is that I did not have any contact. I did not know where I got it. I did not have contact who got from me, and I did not the contact who I got from. Yeah. So that's how mysterious the disease. And of course, as a doctor, I was taking care of myself, washing hands and all this and that. And of course, being a doctor, of course, maybe most likely I got it from a patient who came and I saw, and that's what happened. And that's why COVID is real. It's a very serious disease. And I know, and I thank God that there are so many people actually who got it and passed on. And I know where I was. Me, I was very sick, and the issue was dangerous for me because I had it and it was serious for me, and me, I was to go. Because the number of times I collapsed and I could not know where I was and things like that, there were several. In fact, the first 14 days they were horrible for me. And even after 14 days, the lack of appetite and lack of sleep, and then the last phase, the depression, it was really bad. Right. Any comments? Yes.
Awesome. Nice to hear your story, Daktari. Asante sana. Thank you for your story. You know, we are glad that you're here. You're back. You can tell the story. And I just want to remind all of us, guys, kindly let's take good care of ourselves. Let's wash our hands. Let's sanitize. Let's take care of each other. Let's put on our masks because we do not want the second wave. We don't want it. So let's take care of each other. It's amazing. I drove out of the city, and out of the city, life is almost like normal. Guys are saying, "Yo, COVID isha." Okay, but let's take care of ourselves. Daktari, sasa tell us about this. You know, cancer of the prostate. You know, it's difficult because as men we hope that it will never catch it, but those who have it don't like talking about it. It's a catch 2022, really. So tell us a bit about this disease. and we are calling it Prostrate Cancer Uncensored. And tonight we have ladies here who want to know, and thank you ladies for tuning in. And then we have men who need to be aware. And it is said, especially men who have hit the 40s. So Dr. over to you. Enlighten us.
I'll start by introducing myself. My name is Dr.Geofrey Mutuma, and my background is that I'm a pathologist. So as you know, pathologists are the doctors who make the diagnosis of cancer. So most of the times, before somebody is said to have cancer, is actually a pathologist who makes the diagnosis. So us as pathologists, we actually know how the cancer looks like, and we'll be able to talk about the hospital. I work in the base hospital, which is in South Sea. I know there are so many people who think that the best hospital is in the base, but we are in South Sea, and we normally take care of people with cancer. As we are one-stop cancer center or cancer information center, we start by creating awareness of cancer. We start by screening. We do the diagnosis, of course, as a pathologist. We do the diagnosis for cancer, and we treat the cancer mainly in chemotherapy and radiotherapy. So today we are talking about cancer of the prostate. First thing I want to start, and what is a prostate? Prostate is actually a very small gland which is around the urethra. It's just actually below the bladder. The bladder is where the urine stays, and so it's just below the bladder, and is where the urine actually passes. So you find that the prostate the prostate is the only organ in the body which grows with age. It grows with age. So you find that when a boy is born, the prostate is a size of very small, less than 1 centimeter. And then as you grow up, 18 years, 20 years, it becomes a size of a bean. And then by the time you get 40, it becomes as big as a potato. And then as you grow old, now it becomes big and big and big and big. And that's when you find that actually men, when the men actually the prostate, because I've said that the prostate is below the bladder, and that's where the urine passes. So that men, as you grow older, you find that your urine cannot go very far. Your urine cannot go very far because as the prostate has become big, and it actually is obstructing the flow of the urine. And that's why sometimes you find that when men are very old, they cannot pass their urine, and actually sometimes they are blocked their urine and they cannot urinate at all. And that's actually that is normal phenomenon, and that's called benign prostatic hypertrophy. Hypertrophy is enlarging of the organ. So even that actually the prostate enlarges as you grow old. So so we know that, and something very important is that ladies don't have prostate. So ladies, you listen for men, and that's one of the organs where ladies don't have prostate, because the prostate does not have that major function per se. The only thing it contributes very minimally when it comes to reproductive or to fertility of a man. So a man can be removed to the prostate, and it can remain normal and does not affect the fertility or reproductive cycle of a man at all. So it just produces very little fluid to dilute or to make the seed for men, the sperm, move comfortably. But even if it's not there, it has no effect at all at the production cycle of a man. So it does not affect anything. So cancer of the prostate, what is it? Cancer of the prostate is the growth of that prostate, and the cells become cancerous. And the way we know about cancer is that cancer is not painful at all. I think that's one of the problems I have with the people who believe that cancer is so painful. And I have a problem with people because when they come and I tell them they've got cancer, they tell me, Dr. me, I have no pain, me, I'm okay, and I'm not having any pain. Especially when I see, especially for the ladies, cancer of the breast. I've seen many ladies, especially at the age of 25, a lady refuses completely, and they say that he does not have cancer of the breast, and we can see that he has got cancer of the breast. The same thing with men. When they have got cancer of the prostate, most of the men believe that they don't have cancer of the prostate, and that actually men go, and the only time they come back to me is when they cannot walk, and when the cancer has spread all over the body, and nothing can be done. So cancer of the prostate, cancers are not painful. So cancer of the prostate is not painful. Cancer of the prostate does not necessarily cause somebody to have a problem in passing urine. That's another thing which is very important. It is benign prostatic hypertrophy, which makes men to have a problem of passing urine. Cancer of the prostate does not make a problem of man to pass urine per se. So most of the men, and of course, as we talk today in the best episode today, we have got a man, we have got 2 men with cancer of the prostate, and they came, all of them stage 4. Because we normally see these patients, and we normally admit patients with cancer of the prostate, and this one is actually discovered accidentally. Because as I've said, cancer of the prostate is not painful, does not necessarily cause a problem passing urine at all. So most of the men who come to see us is mainly in stage 4. Stage 4 is when the cancer has moved from the prostate to another area of the body. And that's why most men, they come to us when they have a problem of walking. Because the cancer has gone to the bones in the back, that's the vertebrae, and because that's where most of the cancer has gone, cancer of the prostate. And when that, by the time the man comes to us because has got a backache, he has got a problem of walking, and some of them actually they are paralyzed because the cancer destroys the backbone, and the backbone collapses, and they come in that state because the cancer has gone, and it has actually metastasized to the bone, and eaten all the bone of the backbone. The man cannot be able to stand. So it's actually when they come. So cancer of the prostate starts from the age of 40. The youngest patient I've seen with cancer of the prostate is around 48 years. Although there are some cases which are reported, and men at 43 years or sometimes 40 years can have cancer of the prostate, but rarely. Cancer of the prostate is cancer of retirement. It's cancer of retirement. After you have done your work, you have retired, that is when the cancer of the prostate comes. So cancer of the prostate is a cancer which comes with the age. And that's why we find that cancer of the prostate, the peak age of cancer of the prostate is around 65 years. And because it starts from around 40 and it grows up, and then it peaks around 65 years. And then the older you are, the higher the risk of having cancer of the prostate. So what are the risk factors of cancer of the prostate? There are no risk factors. There's no specific risk factors for cancer of the prostate. And the cause of the cancer of the prostate is actually mainly the exposure to testosterone. That's the hormone for men. And the higher the levels of testosterone, that's the hormone for men, the higher the chance of getting cancer of the prostate. Something very important is that men who are not active, the eunuchs, the men who don't have any sexual functions, they cannot have cancer of the prostate. And that's why we say that cancer of the prostate is directly linked to the levels of testosterone the man has. And that's why you find that most men, they normally have it at later in their life because of the exposure of the testosterone. And of course, when it comes to treatment of cancer of the cervix, cancer of the prostate, not cervix, cancer of the prostate, exactly we remove the testosterone, or we actually give a drug which counteracts the effect of the testosterone, and a man is actually good because of that. So what are the signs and symptoms of cancer of the cervix? Remember that when cancer is stage 1, stage 2, stage 3, no signs or symptoms at all of cancer of the prostate. You don't have any symptoms. When cancer is stage 4, it's actually start having symptoms. And those are the first symptoms of cancer of the cervix, of cancer of the prostate. And the first symptoms of cancer of the prostate is actually what we call dribbling, that you urinate and then the urine does not get finished. And then after some time, you start feeling the urine coming back slowly, and then that's you have got urine obstruction because of the growth of the cancer of the prostate. That's stage 4. And then sometimes you urinate, and then after some time you find that you want to go urinate again. And then sometimes when the cancer has grown and then destroyed the bladder, you start having a urine which has got blood. That blood urine. One of the most important things which actually is a sign of cancer of the prostate is actually backache. Backache is common for women, but backache in a man is very serious. And that's why any man with a backache, when about 40 years, is always good. The first thing is actually to check for cancer of the prostate. And most of the times we have found that most men actually, they come to us with backache. In fact, when a man complains of a backache, the first thing I check is cancer of the prostate, and most of the time we find that actually it is positive. So you find that, and then cancer of the prostate, it can move apart from the bone. Most of the times, almost 50% of the time, it moves to the backbone. That's the vertebra. and it causes, that's why it causes back pain. For men, sometimes they can go to bones in the pelvis or even in the hip joint and start having a problem of walking because it has gone to the hip joint. But most of the times when it affects the backbone, it also affects the nerves, because we know the backbone, that's the root of, or the root where the nerves start, and you start having problems of walking or problem of the pain, which actually is radiates in one part of the leg or the lower limb. So those are the major signs of cancer of the prostate. Now, when cancer of the prostate, those are the specific signs, but other signs is that the man starts losing weight, is eating normally but losing weight. Sometimes it may not have blood, because we know that cancer sucks the blood from the body. So sometimes you find that actually the man does not have the blood. And then, of course, there's general weakness, and general malaise, and general fatigue, because, of course, as the cancer progresses, actually it destroys other parts of the body. So the cancer of the prostate is actually the commonest cancer in men in Kenya. Cancer of the prostate is the commonest cancer in men all over the world. So cancer of the prostate is the commonest cancer in men. So for men, these are cancer we need to take care of. And this normally is very important, because as I've said, and I'll repeat again, cancer is not painful. That's the only thing which I need to tell people, that cancer is not painful, and you don't wait until you have pain because of cancer, so that you can go for treatment or seek treatment per se. So cancer of the prostate, I've said that is number 1 in Kenya. Of course, number 2 is cancer of the esophagus in Kenya, and then we have got cancer of the stomach, and cancer of the colon, and cancer of the liver. That's how cancers follow in men. So in Kenya and most of the countries, we find that actually cancer of the prostate affects in every 12 men, 1 man will have cancer of the prostate. That's how common it is. It means you count 10 men, 12 men, 1 man will have cancer of the prostate. And of course, it's this mainly at the age of 70 years. So it's very important to know that, and all men and also women to know that cancer of the prostate is very common, and this is a cancer which we need to screen. And this cancer, which is easily screened, very easily screened, is very cheap, is not expensive, and that's why I normally recommend men from the age of 40 years, you can start be screening. Now, let me talk about screening. The first thing about the screening is that any screening test is supposed to be cheap, and cancer of the prostate, we normally screen by a test, we call it PSA, prostatic specific antigen, and this we remove blood, and the blood removes very little blood to do cancer screening of the prostate, and that's why normally advanced men is good to be screened for cancer of the cervix. That other method, I know the method which men don't like it. We stopped it long time. The digital examination of cancer of the prostate, we stopped it long time. So no, men should not be scared about it. It's very simple test, and once you are 40 years, just go and be done your PSA. PSA is actually a very easy test which can be done. Most of the times, I know there's some controversy on doing the PSA, which I don't support it, because I've seen, my experience is that most of the people who have been done PSA and it's positive, when we do the levels, because the screening test for cancer of the cervix is doing the PSA, and the levels, you check the levels of PSA in the body, and that's when we know that cancer of the cervix or cancer of the prostate when the PSA is high. Most times the PSA at the normal level is up to 4 nanograms per liter, but then when it's above 4, we say that you have got a danger of having cancer of the prostate coming in. But when it's above 10, most of the times we say that you've got cancer of the prostate. Most men, when they come with cancer of the prostate, the levels of PSA is actually above 100. So there's no question about it. When the cancer of the prostate is there, we can be able to diagnose very easily. So cancer of the prostate is easily screened, easily diagnosed, and what is very important, easily treated. Very easy. One of the easiest cancer to treat. And there are several methods which we actually treat cancer of the prostate, because we find that actually the prostate, the way I've said is that we just remove the effect of testosterone, and we give hormone, and the hormone which we give, it counteracts. In fact, we just give you injection. Cancer of the prostate, we don't give chemo. We don't give chemo at all. We just give some hormones, and then after 3, 4, 6 months, the man has no cancer of the prostate at all. So what's the procedure now? Patient has come, we have screened the patient, we have found that he has got cancer, he has got a likelihood of having cancer of the prostate, we have done PSA, he has got high levels, so we need to make a definite diagnosis of cancer of the prostate. Remember what I've said, the definite diagnosis of cancer by doing histology, and this is removing as more tissue from the prostate or from the organ which is affected, and then we take to a pathologist who looked at it and confirms actually this is cancer of the prostate. Remember, you cannot say a patient has got cancer without histology, because histology is the hallmark of diagnosis of cancer. And that's why you find that whenever you got cancer, people are told that there's something, they have to be removed something, and then it's taken to be checked, and then the result comes. And normally, when we do like that and confirm it's cancer of the prostate, now we start the way of treatment. And the way of treatment, as all cancers, the treatment modality is actually I like dividing the cancer treatment into 5 ways of treatment. The first one, cancer treatment. The first cancer treatment, it is counseling. The first cancer treatment is counseling. First, to make the patient understand that he has got cancer and the disease he has is serious and the treatment is long time. I know as we are used to taking drugs. Remember when I was having malaria with my COVID, you take treatment for 3 days, you are cured, you have no problem. You are admitted for 3 days, you are given antibiotics, you are cured, you go home. But cancer is a disease which takes treatment for a long time, and it is both draining, both physically, spiritually, financially. So it's very important to inform the patient, and more so the relatives, because the patient needs a lot of support from the relatives. So you need to counsel them so that they know this is a disease and you take a long time for this patient to be treated. And that's why we normally tell people the first thing, that before you start the treatment, it's good to be able to advise the patient on the disease and the disease issue. Remember, it is not easy to tell somebody he has got cancer, and you have to be careful. And I know most of the families, actually, most of the people come to see me, they tell me, don't tell that our dad has got cancer. You can imagine, a patient is with you, you want to treat him for six months, the drugs you give him, of course, is not complicated for treat cancer of the prostate, but of course, you be coming for treatment, the patient does not know that he has got cancer. And that's actually, and some people, they say like that. And remember, during counseling, and when you are telling the patient he's got cancer, there are people who refuse the treatment. They refuse the treatment completely. They say, me, I don't want to be treated, and the patient actually go home. And they say, me, I don't want to be treated, I better die. And remember, when you say that I don't want to be treated for cancer, I better die, definitely you will die. There's no question about it, because cancer is a serious disease. And that's why counseling is normally very important for patients to understand actually what he'll be able to go through. And that's why now normally we advise the patient, we give them counseling. So the first treatment of cancer is counseling. And I know so many people have started treatment of cancer without counseling, and that's normally very serious. They have started treatment of cancer without counseling, and I know some people actually, they have really a problem just because of that. Second treatment of cancer, it is diet. Second treatment of cancer is diet, because remember, risk factors, I'll just give the general risk factors of cancer, not necessarily the prostate, but when somebody has got cancer, we advise them which food not to eat, and which food to eat. And remember, one of the risk factors which we have in Kenya, and is major, is our diet. People ask me, Dr., why has cancer become so very common? It's because we have changed our diet. We have moved from the typical African diet to Western type of diet. In fact, most of us, the Kenyans, even in the rural area, we eat the Western type of diet, where we eat a lot of refined food. And we are not aware about that. And actually, that's one of the risk factors. So first thing is that we tell the patient, stop taking sugar, because sugar is a cancer feeder. So the more sugar you take, the higher the chances you have of developing cancer. And also when you've got cancer, because cancer likes sugar very much, And that's why cancer makes people to lose weight, because it takes all your sugar from the body. So cancer likes sugar. So the more sugar you take when you've got cancer, cancer is like a fertilizer. Cancer is like a manure sugar is like a fertilizer for the cancer. Sugar is like manure for the cancer. So we discourage people from taking sugar and also taking milk, because milk makes also cancer grow. And then we discourage people from taking refined food, refined chapati, refined ugali, refined rice. We tell people take brown rice, brown ugali, and brown bread. That's what we normally encourage. And then we advise people to take a lot of fruits and vegetables. In fact, one of the things which I found very useful is that we normally tell people take fruits and vegetables, and that actually they are very useful when it comes to treatment. Remember, we are talking about a patient who has got cancer, and we are talking about treatment. The first treatment is counseling. The next treatment, it is actually diet, which is very important. The other one, which actually we normally recommend our patients, is supplementation. Remember, we have talked about diet, and diet we need to supplement. In most cases, we normally tell people supplement. Supplements is just vitamins. We tell people take vitamin B. Vitamin B is for blood, and then vitamin C, the fruits, and then we tell people take a lot of fish oil. That's omega-3, which is normally very good. And of course, depending on the patients, there are other supplements which you can be able to give the patient. Now, remember, we are talking about treatment. We have not started treatment of cancer of the prostate. We are just talking about counseling. We have talked about food. We have talked about supplements. Those are very important, because once you just rush, and I know most of us doctors, we just rush to the treatment, real treatment, we mess up. And I've seen most of the patients, most of my patients who have gone through those 3 cycles, they do very well and they survive cancer very well, irrespective which cancer it is. And any patient who does not go through those three methods, it becomes very difficult for treatment of cancer. Now, what is the treatment of cancer now? Real treatment of cancer. The first treatment of cancer is surgery, removal of the cancer. You are taken to the theater and the cancer is removed. The second type of treatment of cancers is chemotherapy. Chemotherapy is giving the patient drugs. Chemotherapy is when you are given the drugs, they go and kill the cancer cells. And the third method of treatment of cancer is radiotherapy. You use X-rays to kill the cancer cells. Now, let us come back to prostate now. That's a general. Most of the patients who have cancer of the prostate, actually they come in stage 4. So you find that at stage 4, surgery is out. And most of the times, we don't advise surgery or prostatectomy for treatment of cancer of the prostate. We just go to chemotherapy. And remember what I've said, in the chemotherapy, we don't use chemotherapy, we don't use drugs, we just use hormones. And that's why treatment of cancer of the prostate, the complications are minimum, because chemotherapy has got a lot of complications. But people who have got prostate, they don't have a problem because we just give them hormonal treatment and becomes okay. Now, before we start the treatment now, let us talk about the test which we need to do for the patient who has got cancer of the prostate. Before we start the treatment, first, we have counseled the patient, we advise of the diet, we have given the patient supplement. And these are done even before we start the treatment of cancer of the prostate. And this, when it's done, when we start the treatment, it becomes easy. Remember, I've said that surgery is not an option nowadays for cancer of the prostate. We just go for the drugs. So before we give the patient the drugs, what we need to know? First, we need to know, does this patient have enough blood? Because most of the times, the way I've said, a patient comes and there's no blood at all. So you cannot start treating the patient where that does not have enough blood. Remember, when I'm giving these drugs about from blood, we have to check is urine, is kidneys, how are they? Most of men who have got cancer of the prostate, and they normally have a problem of renal failure, because remember what I've said, that the prostate, when it enlarges because of cancer, it blocks the urine from passing, and then the urine goes back and it goes and destroys the kidneys. So it's always good to confirm that actually the kidneys are functioning well. And apart from the kidney function, remember, these hormones, these drugs which we give, they're eliminated through the kidney. So we have to check that if the kidney is not functioning well, it means that this patient will not be able to eliminate or remove the drugs from the body. And then we have also to check the liver, because as you know, the drugs, once we give the patient, is normally removed by the liver. That's called detoxification. The liver removes all the drugs. So we have to check the function of the liver. Now, what's also very important, apart from checking the blood and check the urine and confirming all the organs are perfect, we have to check where is this cancer, how large is the cancer, what is the size of this cancer. As this cancer moved from the prostate to other parts of the body, and that's why we normally do X-ray. We like to do X-ray of the chest to check if the cancer of the prostate has moved from the prostate to the chest, because if it has moved from the prostate to the chest, it means that we have to use chemotherapy and other radiotherapy to be able to remove that cancer. Most of the cancers, they move into the backbone, the way I've said, so we have to do MRI. We normally call it morbid MRI to check if the cancer has gone to the bones in the back. That's the vertebra. When the cancer has gone to the vertebra, what we do, actually, we don't start by giving chemotherapy or hormonotherapy. We start by doing radiation. Radiation, actually radiotherapy, because cancer in the bone, the best way to treat it is actually doing radiotherapy by focusing the beams of X-ray to where the cancer is, so that will remove the cancer from the bone, and that's actually where we normally start. So MRI, CT scan is very important to check the size of the cancer around the pelvic region. As it affected the bladder, as it affected the organs which are around the pelvis, because that's also very important. And also we can do the MRI just to stage, to know which is the stage of the cancer, so that by the time we start treatment, we know where the cancer is, and that one becomes very important, because later when we are following the patient after the treatment, we need to check to know where the cancer was as it moved from there, because also it's very important, because that it depends on the cure rate, and if the cancer has been wiped out by the hormones or by radiotherapy. So that's actually what happens. So there's actually what happens before the treatment, and during the treatment, and after the treatment. Now, how do we treat the cancer of the prostate? I've said that we normally give injections. We normally give just a small injection below the skin, mainly in the abdomen, and we normally give for 3 months. Every month we give you a drug, that's hormonotherapy. After every month we give you a drug, and we give you 3 times, and then after that we give you after every 3 months. We give you 3 months every month, and then after that we give you 3 months after every 3 months for 3 times. That it means that's 3 months, and then another 3 months, that's 6 months, another 3 months, that's 9 months, and then another 3 months, that's 1 full year. And that's why it's very important to inform the patient this, it will take long time. The good thing about the prostate treatment is that when the patient comes to the hospital, given injection, he just goes home. He does not need to stay in the hospital unless he has got some complications. Or the only time when the patient stays in the hospital for a long time is before the treatment. Before start the treatment, when we are doing the test for the urine, for the blood, for the liver, for the kidney, when we are doing the X-rays and MRIs and CT scan, that you need to stay in the hospital before we start the treatment. But after we know where we are, we start the first injection. The next time when it comes, it's just to check his blood and check how he's doing, and then after that we just give him injections. He goes home, and then it comes like that, and then it becomes very easy. That's why I've said that from the beginning, that treatment of cancer of the prostate is very easy, straightforward. It's not complicated at all. The only thing is that there are some people who refuse to for treatment, of course, because they've got a lot of myths, a lot of beliefs which are not real, and that's how it is. Right. Awesome. I think that is the end, and now you can have questions. Awesome. Anything I've left. Yeah.
Awesome. Asante sana, Doctori. It's been real. You know, that one was shocking. I was shocked when you said statistics that 1 out of 10 men most probably has cancer of the prostate, and that's the statistics. Amazing stuff. Let me know what you have learned tonight, and then let's get ready with our Q&A. Kindly type your questions. I'll be reading them out nice and loud to Doctori, so that he can tell us where do we go from here. But before we take questions, Daktari, you talked about how easy it to treat the disease, you know, the cancer of the prostate. And I really like when you talked about counseling, you know, because it's one of the things we have talked about many times. And even before this, when you were talking about COVID and you mentioned counseling, and I want to remind people that if there's one thing that you need to be careful about is your mental, is your, you know, up here, so that you are okay mentally, then it also helps to just sort out your other issues. I thank you, Daktari, for also talking about the diet. No milk, no sugar. Haya, na vile watu wanapenda chai mahali hapa. Then supplementation, and then the treatment, which is either surgery, chemo, or radiotherapy. And let me just read a few of what the people are saying. Daktari, someone said that we thank God that you are alive and well, Dr. Mutuma, and COVID-19 free. For those who tuned in a little later, our Daktari is also a COVID-19 survivor. We've had his story tonight, and COVID is real. Yes, we need to be cautious of that reality and take all precautions. Thank you, Kavak, for that. Irene says, Askofu Abraham anakula dinner, video ikiwa on. Well, Askofu, enjoy your meal. I hope hujaweka chai ya maziwa na sukari mingi. Avoid that. Let's sit. Where does meat stand when it comes to diet? Daktari, that's the first question. Where does the meat stand when it comes to diet? This guy really likes nyama choma. Ukiona mwanaume anaanza kuuliza maswali kama hii, he's very hopeful that you will put him on the green and not on the red. Daktari, let's take Lesit's question about meat.
Right. I think I left. I'm sorry I left about that. Actually, red meat is risk factor for all the cancers. It's more a risk factor of cancer of the colon, but I think it's a risk factor for all the cancer. That's why we normally advise patients that in our diet, we normally tell people that you stop eating red meat. You eat white meat, mainly chicken and fish, and you stop eating red meat. Red meat is a risk factor of all the cancers, and that's why you find that the consumption of the meat in Kenya is very high. And that's why I've said in most cases, you go to a small town or a small market or a small marketplace, like in South Sea where we are, you find in the morning, you've got 4 carcasses in the butchery, you've got 4 cows hanged there. In the evening, there's none. You just find the bones. Where has that meat gone? Red meat. Kenyans like red meat. Red meat is not good at all. You need to eat red meat most times, even 2 times in a week. I know there are some, not some, most of the Kenyans. There are some Kenyans who eat meat every day. Yes, yeah.
Lesit pole sana, Daktari is saying, punguza nyama choma, do a little more of fish and chicken and white meat. And then Daktari, Lesit also asked, can one do a self-test at home? You will answer that in a short while. Can we do a self-test at home? This guy is trying to avoid coming to the hospital. But tell me about that, Daktari. Can one do a self-kit at home, a self-test?
Yeah, doing the PSA test is so easy. The rapid test, it's like blood sugar. You can go and buy the strip, and then you just remove little blood. You put it on the way you put it in doing blood sugar, and then it shows you strip. When it has 2 strips. When there's 1 strip, it's negative. When there are 2 strips, it means that it's positive. It's very easy. You can do it at home, provided you have got your bought the strip, and they are quite common in most of the pharmacies. Just ask for PSA strip, you just do it and then you know. Especially for guys who have got diabetes, it's the same way you do the diabetic test. You do the blood sugar, so it's very easy and straightforward, and it reads for you very easily. So you can do it at home. Right? Hello?
Okay, so you can do your test at home right there. Let's see, yes. Kindly do your test tomorrow if you're over 40. Let me see. Irene is saying that she has learned a lot, that prostate is not very important for reproduction. I have learned that prostate is not very important for reproduction. And then Joshua is saying, what is the role of exercise in the management of prostate cancer? Is there what is the role of exercise in the management of cancer? Chege is, let me ask two questions, Dr. and then you go. And Chege Isaac is asking, does the prostate cancer depend on lifestyle? Which are the risk factors, Dr.?
Right. I think I'll answer the two questions at once, because the risk factors of cancers, before I come to risk factor of cancer of the prostate, the first one is diet. The second risk factor of cancer is diet. The third risk factor of cancer is diet. The fourth risk factor of cancer is diet. Diet. I've talked about it. Second, overweight. When you are overweight to 70 kilograms above, it means that you are a risk factor of developing cancers, and the prostate is also there. And then the other one is lack of exercise. Remember, nowadays we are not doing any exercise at all. And the lack of exercise is a major problem of cancer risk factors. And then the other risk factors is actually alcohol, taking alcohol, and also smoking. And then very important, and this is very important, listen at it, everybody. Cancer of the prostate, it is genetically inherited. Cancer is a risk factor. When your parents or your grandfather have got cancer of the prostate, there's a chance in the same family will have so many people of cancer of the prostate. I've seen so many families where all the brothers had cancer of the prostate. All the brothers, cancer of the prostate, and you find that actually the dad of those brothers, he had cancer of the prostate. And when you do what we call autopsy, you find that actually the grandfather must have died cancer of the prostate. So cancer of the prostate is genetically inherited. There are 4 cancers which are genetically inherited. There are 4 cancers which run in families. And this is cancer of the breast, cancer of the ovary, cancer of the colon, cancer of the prostate. All those cancers run in the family. Now, something very important is that when one family member had cancer of the ovary, assume as cancer of the ovary, it means that in that the same family will have so many people, we can have many people cancer of the prostate, cancer of the colon, cancer of the breast in the same family. So when one person has got cancer of the prostate, it's very important to make sure that at least in that family, we follow them more keenly. They do screening more keenly because they have a chance of having those cancers. So those are the risk factors of cancer of the general cancers. Risk factor of cancer of the prostate, I've said the first one is exposure of testosterone. That is the hormone which is produced from the testes. That's why it's called testosterone, because it's a prostate, it's actually cancer which is, it's a hormone which is produced and the hormone which makes men to be active. So the higher the exposure of cancer of the testosterone, the higher the chance of having cancer of the prostate. So cancer of the prostate is directly linked to the levels of testosterone. Yes. I think I've finished. Anybody with a question?
Dr. A little candid here tonight, okay? When it comes to prostate. Someone is asking, does it affect the game, you know, badminton? Does it affect, you know, some people have the myth that the people who are more sexually active, either it reduces or it increases the chances of getting prostate cancer. Enlighten us on that.
Okay, there's something which I've said is that the more active the man is, the higher the chance of having cancer of the prostate. The more active a man is, the higher the chance of getting cancer of the prostate. And that's why I've said the higher the levels of testosterone, the higher the chances of having cancer of the prostate. And that's why the more the exposure you have on cancer of testosterone, the higher the chances. Now, I've said again, men who are not active, the eunuchs, they cannot develop cancer of the prostate. And also, cancer of the prostate, as we know, is more common in blacks than in whites because blacks have got higher levels of testosterone. Now, when you've got cancer of the prostate, does it affect your libido? No, it does not affect your libido, but it's very important. When we started treating you for cancer of the prostate, it affects your libido. In fact, most people, their libido goes to zero. Remember, treatment of cancer of the prostate, we are removing the effect of testosterone. Testosterone is what makes the man to be active. So treatment of cancer of the prostate, it makes the man's libido to go very low. Remember before, the hormonal, even up to this time, one of the treatment of cancer of the prostate is actually doing octectomy. Octectomy is actually removing the balls, removing the testes. And that's actually was one of the best ways of treatment cancer of the cervix. Just remove the testes and the man will survive without a problem. Remember, even when we are using the hormones, in fact, the hormones, they just actually remove the effects of the testes, so that the testosterone is not produced. So it's just the same effect. And that's why it's a men, because when we have to explain to them like that, and when most men, when they hear that like that, they say, me, I don't want to be treated for cancer of the prostate. I better die with my prostate. And when you say like that, as sure as death, it will come. Because cancer of the prostate, it is very aggressive, especially when you are diagnosed cancer of the prostate before 60 years. It is very progressive. If you are diagnosed cancer of the prostate at 40 years, 50 years, the cancer is so aggressive. Within 6 months, it has gone to the bone, it has destroyed the bone, it has gone to the brain, it has gone to the liver. So the younger you are, the more aggressive the cancer is. When you are 90 or 100 years, in fact, we don't bother to treat you because it's not actually very, very aggressive. But between 50 and 80 years or 90 years, there we need to be able to treat the patient because it's very important. But once you're above 96, 100 years, we don't bother to treat your cancer of the prostate. Yeah.
Asante Daktari, I think you've answered Esther's question. She was asking, my grandpa is 80 years. He is diagnosed with prostate cancer at stage 4. Is there any hope? And I think towards the end, you have answered it well, that yes, there is hope for them because it's not as aggressive. All right. Yeah. So, ladies and gentlemen, as when we come back, I want to before we wind up, which we will be doing in a short while, I just want to remind you that to book a date and mark your diaries on the 10th of October, the year of the Lord 2020, is the year that we will be having our Boot Cancer Challenge, Outburst Boot Cancer Challenge 2020. It will be the 5th edition of Outburst Boot Cancer Challenge. That's why today I'm in a t-shirt and not in a someone calls them a t-shirt ya ikulu. Okay, just to show you that on Saturday, the 10th of October, we will be having our first ever virtual Boot Cancer Challenge right here. Wherever you will be, just tune in at 8 a.m. to 10:30 a.m. We will have aerobics, we will have Zumba, we will have yoga, we will exercise a bit, we will be hearing from nutritionists, we will be hearing from doctors, we will get time to be enlightened, inspired, we will have fun, but most of all is that we are doing this to keep hope alive. I also want to remind you that as we do this to support those who are fighting the disease, those who are caregivers, those who are in the palliative care, and as we support them, we believe that giving is better. The joy of giving is greater than the joy of receiving. And so, ladies and gentlemen, I want to request you to send your support to the till number 750-822, and all our proceeds are going to the Geo Hospice in Kiambu County. The 10th of October will also be marking the World Palliative Day, and so we will be doing that and Candid Conversation has been a build up towards that, and that is after that day we will take our proceeds there to the GIO and we'll support them. I want to remind you again, the number to send your support is the till number 750-822. I want to also acknowledge all our partners and all our sponsors. From the time we started, the past 4 years have been amazing. What a journey it has been. And I want to just say asante to all of them, all our sponsors, all our partners, all our friends, and the people who have been attending the Boot Cancer Challenge for the past 4 years. We want to say asante, Asante sana. We want to recognize Safaricom, Shell, V-Power, Davies and Shatcliffe, Arambe Sacco, Cedric, Trianum, Anjawala and Kana, Serena Hotels. They've been amazing, amazing. We've had partnership from Unclaimed Financial Assets Authority, MP Shah, Lancet, Medanta, Aga Khan, Asante sana. One of the people who always attend is none other than Loreto Convent Msongari. They have been there for all the 4 years, and we want to call upon them to be with us at the 5th year virtually. Unicode, the House of Doti, A to Z to Tugraphy. You guys are close in my heart because you've stood with us all the 4 years. KNW Limited, Solution, Solu Health, Wellness, Fulana, you know, they run a gym there at the All Saints Cathedral. And Ramani, want to say thank you. You guys have been amazing. With the Aquadrop and Mainnet, all the 4 years, they've been quenching our thirst. And then we want to also recognize the people who have put us on media, K24 Family TV. At some point, we were on Citizen. We want to say a big up, thank you so much. And then the people who are in the fight together, just sharing the, you know, the supporting those people living with cancer, supporting caregivers. We want to salute you. Faraja Cancer Support Africa Cancer Foundation, Kenya Hospice and Palliative Care Association, we salute you. Amre Flying Doctors, you have been of great help to us. Thank you so much. And last but not least, we want to say asante to East Africa Institute of Professional Counselors who have come in a big way, even in candid conversation, and not forgetting Zambezi Hospital. We want to say asante sana. Ladies and gentlemen, as we wind up, we want to say kindly support us, kindly partner with us, book a date with us on the 10th of October 2020 from 8 a.m. to 10:30 p.m. Let's get together, let's get enlightened, and let's keep hope alive. Daktari, I want us to wrap it up in the next 5 minutes or so. I'm looking at the best few questions to ask you. What is the success rate of treatment of prostate cancer? What is the success rate, Daktari?
The success rate is quite high for cancer of the prostate. We are talking of over 75%, because the treatment of cancer of the prostate is very easy, not complicated at all. In fact, I can't remember a patient we lost because of cancer of the prostate. The only patients who we lose because of cancer of the prostate are those who refuse the treatment. Because once the people we treat, it's very easy.
I like the way you're putting a lot of hope to us tonight. Thank you so much. Someone is asking, you know, what are the causes of high testosterone? Because that's the one thing that you have mentioned time and again. And then someone is saying, you know, so why the big deal? Why can't we just remove this thing when people hit 40 and we know we can come to the hospital, I remove it, and I continue enjoying my life, Daktari?
That's a good point. But remember that even if you remove the prostate, you don't remove the chances of getting cancer of the prostate. There are so many people who are be removed the prostate, but they still have cancer of the prostate. By the small bits of the prostate which are left there, they always develop cancer of the prostate. We have seen so many people who were removed prostate because of benign prostatic hypertrophy, but they still develop cancer of the prostate. Removing it do not solve a problem. And remember, you cannot remove an organ when it's not sick. It is not ethically right. It's like cancer of the breast. Some women, they say that I don't need my breast, so why not remove? Remember, you cannot do that as a doctor. It's not ethically and morally right. So for cancer of the prostate, you cannot remove it until it has a problem.
All right, as we wind up, ladies and gentlemen, I want to say thank you. Tonight has been great. It has been a great night. We are going virtual. We have been going virtual even with our training and team building. Kindly get in touch with us for your corporate training, team building for remote teams. I want to say thank you so much tonight. Daktari, before I wind up, let me hear your parting shots on this topic tonight, prostate cancer Uncensored. Give me your parting shots before I wrap it up.
Right. My parting shot is that I advise all men above 40 years to go for screening cancer of the prostate. And then I think I'm giving the children or the wives of men, before you celebrate your birthday of your man, or before you celebrate your wedding day of a man, ask him, have you done your prostate screening? If you want your man to stay for a long time, if you want your dad to stay for a long time, before you celebrate his birthday, so that you have many birthdays for him, before you celebrate the wedding anniversary, ask him, have you done your prostate PSA screening test? Thank you.
Awesome, awesome. Before you go, Dr. Let me do this last one, because Samuel Mboro, Samuel Mboro is saying, how hard is it to identify this cancer? Our grandpa is currently going through the treatment for the prostate cancer. He has been ailing for the better part of this year, but diagnoses were not giving a positive result at KNH until this month when Nairobi Radiotherapy and Cancer Center gave the results. We have donated blood twice now, hoping for healing. What can you tell Samuel tonight?
It's very easy. Diagnostic cancer of the cervix of the prostate is very easy. It's very easy. So it's and who's above 44 years or 45 years, 50. The first test you do anytime, do PSA all the time. PSA rapid test, which is very cheap and is not complicated. You really miss when you do rapid test. Even the PSA levels is very important. Those are the first tests you do for cancer of the prostate, and they are straightforward and they are diagnostic.
Awesome, awesome. Thank you so much, Dr. You've been awesome yet again, like before. I never get the end of listening to you. You enlighten us, you educate us in such a simple way. We want to say thank you so much, guys, for tuning in tonight. Tonight we have set a new record. I have never seen so many men tune in like I have seen tonight. So men, keep it up. Ladies and gentlemen, we have one more episode before we wrap up Candid Conversation Season 1. So next week on Wednesday, kindly be here. It shall be a nice platform where you can ask as many questions as you want. We'll just be here to have fun. It will be on from 7 to 8:30, and we will have a panel of different people. We'll have the nutritionist, we will have a cancer survivor, we will have a Dr. Mutuma. I want to request you to be available next week also. So kindly tune in, and we also want you to let us know which topics would you want us to handle season 2, when we come back, which topics would you want us to address? Kindly type them, let us see. You can also contact us. We will put our contacts right there. Contact us, let us know how we are doing, what you'd want us to do for you, and we will consider. Lastly, guys, I want to remind you yet again, book a date with us on the 10th of October 2020. It will be a Saturday from 8 o'clock to 10:30. We shall have fun together virtually. It shall be our first ever Boot Cancer Challenge event. If you are here and you can sponsor the event, kindly do so. Sponsor us, partner with us. Let's make it happen big. Kindly invite as many friends, family, relatives, and even your enemies, because we want all of them alive and well. So kindly do that. Lastly, I want you to be a partaker of great blessing of giving. And year after year, we have given towards charity. On the Boot Cancer Challenge, we have given to the Geo Hospice. And this year will not be different. We made a commitment. COVID, no COVID, we shall support them. And so the number to give and join the list of philanthropists, the number to give is 750-822. If you want us to also come for a check, we can do that. Just sponsor, be part of this. The number to give, Lipa na M-Pesa, till number 750-822. Give whatever you can, and I can promise you that this is going for charity. It's not going to pay our salaries. We are blessed of the Lord. We are doing okay, but we want you to be a partaker of this blessing on the joy of giving. Until next time, this has been Candid Conversation, Season 1, Episode 9. And next week, we shall be closing on Episode 10, and then going right on Saturday for the Candid Conversation, for the Boot Cancer Challenge, the 5th edition, and it shall be virtual. Thank you so much for tuning in. It has been real. Until next week, I want to say adios, amigo. God bless you. You guys are stars. You are awesome. God bless you. Mwah. Until next time, good night.